Welcome back. If you've made it here, it means you're committed, not just to understanding healthcare, but to mastering the strategic role that medical affairs can play within it. And that's exactly what sets you apart. In the previous tutorial, we explored the core players in the healthcare ecosystem: patients, caregivers, HCPs, payers, and their growing expectations from medical affairs and the pharmaceutical industry. We talked about evidence, trust, relevance, and the importance of tailoring our approach to match each stakeholder's value lens. But as we mentioned, those aren't the only players shaping today's healthcare decisions. In this second part, we're going to expand the lens. We'll dive into policymakers, regulators, provider institutions, digital health and tech innovators, and advocacy groups. These stakeholders may not always be in the spotlight, but believe me, they are shaping the rules of engagement, access, and innovation in ways that directly affect everything we do. And more importantly, we'll talk about how to align across all these stakeholders. Because in strategic medical affairs, it's not just about speaking the right language. It's about building a consistent, credible narrative that resonates across the ecosystem. So if you're ready to elevate your thinking and position yourself as a connector, not just a communicator, then let's dive into part 2 of this tutorial. Let's pick up where we left off and take this conversation to the next level. Let's talk about another powerful segment in the healthcare ecosystem: policymakers and regulators. These are the people responsible for setting the rules, approving medicines, shaping public health frameworks, and ensuring the overall integrity of the healthcare system. So what do they actually need? At the top of the list is compliance with regulatory standards. That may sound obvious, but it's more than just ticking boxes. Regulators are tasked with safeguarding the public. That means they need clear, transparent, and verifiable documentation that your product meets safety, efficacy, and quality thresholds, not just at launch, but across its life cycle. Second, they need data integrity and patient safety. In other words, clean science, ethical conduct, and traceable processes. If there's a safety signal, a manufacturing issue, or even a data irregularity, regulators expect transparency, and fast. For medical affairs, that means we have a role to play in ensuring that scientific communication is consistent, accurate, and aligned with evolving safety data. Third, policymakers are increasingly focused on evidence that addresses public health needs, not just commercial interests. They want to see that a new therapy solves an unmet need or contributes to a broader health goal, like reducing hospitalizations, addressing health inequities, or managing chronic disease burdens. When we engage in early scientific advice meetings, we must be ready to show how our innovations align with the bigger picture, not just the product label. And let's not overlook the need for transparency and collaboration. Regulators are not the enemy, they're our partners in ensuring that patients get access to therapies that work and are safe. They expect industry to work with them proactively, share risk data openly, and involve them in shaping trial designs and post-marketing plans. This is where medical affairs can be incredibly valuable, acting as the bridge between scientific teams and the regulatory landscape, translating complex data into strategic dialogue. So here's the takeaway. Policymakers and regulators aren't just box checkers. They're shapers of innovation. And the better we understand what drives them, the more effective we can be in aligning science with the systems that govern healthcare delivery. Medical affairs is uniquely positioned to have that seat at the table, but only if we come prepared with rigor, transparency, and a deep respect for the responsibility these stakeholders carry. So what do policymakers and regulators actually expect from us, specifically from medical affairs? Well, they're not expecting us to come in with flashy branding or marketing spin. What they're looking for is something more foundational: credibility, collaboration, and clarity. Let's start with the expectation for scientific contribution to public health policies. Regulators and policymakers don't just want companies to meet minimum requirements. They want meaningful input that helps guide national or even global healthcare strategies. That could include contributing data to vaccine policy, being involved in rare disease frameworks, or providing evidence to support screening programs. They expect medical affairs to show up not just as product specialists, but as public health contributors. Next, they expect us to participate in expert panels and scientific committees. These are not promotional platforms, they are spaces where strategic health decisions are shaped. Whether it's a Ministry of Health roundtable or a regional HTA consultation, medical affairs professionals are increasingly expected to bring forward real-world insights, clinical trial findings, and unmet medical needs in a neutral, evidence-based manner. Another major expectation is our contribution to post-marketing surveillance and pharmacovigilance. Regulators want to know that once a product is launched, there's a system in place to monitor its performance and safety in the real world. Medical affairs is often at the center of this, gathering insights, helping interpret data, and communicating updates in a timely and transparent way. And finally, regulators expect alignment with national and regional health priorities. That means understanding what each country or region is focused on, be it reducing non-communicable diseases, improving access in rural populations, or optimizing digital health tools. When we come to the table with evidence or solutions that support those priorities, we're not just seen as a pharma company, we're seen as partners in healthcare improvement. So if we step back for a moment, the message becomes clear. Medical affairs has the potential to play a much more strategic role in policy influence, but only if we think and act beyond the product. Policymakers don't want just another industry voice. They want trusted, evidence-based partners who understand the broader vision for healthcare. Let's make sure we rise to that expectation. Let's now shift our focus to a stakeholder group that often gets lumped together with individual HCPs, but actually plays a very different role: healthcare providers and institutions. Now, when we talk about providers here, we're referring to hospitals, integrated health systems, academic medical centers, and large specialty clinics. These aren't just places where care happens. They are organizations that manage infrastructure, shape formularies, and influence how innovation is adopted on a system-wide level. So what do these institutions need? First, they're looking for support in building integrated care models and outcome tracking systems. That means moving from reactive episodic treatment to proactive longitudinal care. Institutions want to reduce readmissions, streamline transitions between inpatient and outpatient care, and align multiple departments under one cohesive strategy. Medical affairs can support this by providing outcomes data, real-world insights, and medical education aligned with these goals. Second, they need data sharing and interoperability. This is a big one. Hospitals and clinics are flooded with information, from electronic health records to imaging to lab results. But too often, those systems don't talk to each other. Providers want solutions that help integrate and analyze data in a way that improves decision-making. If your clinical evidence or patient support tools can plug into their systems, that's a huge advantage. Third, institutions want help in guideline development and clinical pathway optimization. Many of them operate under internal protocols or are involved in national initiatives. They look to medical affairs to contribute high-quality evidence, expert consensus, and support for educational implementation. Whether it's a cancer center refining its treatment pathways or a hospital group developing an antimicrobial stewardship program, medical affairs has a role to play. And finally, they're focused on the safe and scalable implementation of innovation, whether it's a new biologic, a digital diagnostic tool, or a gene therapy. Institutions are asking, how do we implement this safely? Who should be trained? What infrastructure is required? And they expect medical affairs to have thought through these operational realities, not just the science. So here's the key point. Healthcare institutions are not just passive environments where our strategies play out. They are active players with their own priorities, constraints, and decision-making processes. If you want your medical strategy to succeed, you need to understand not just the physician, but the system around them. This is where medical affairs has a strategic edge. When we understand how institutions operate, we can co-create solutions that are not just clinically sound, but operationally feasible and system-ready. All right, now let's talk about one of the most rapidly growing and increasingly strategic stakeholder groups in the healthcare ecosystem: technology and data partners. We're talking here about companies and collaborators involved in digital health, health informatics, AI, machine learning, wearable devices, electronic health records, and real-world data platforms. These are not just service providers anymore. They are active players shaping how healthcare is delivered, measured, and reimbursed. So what do these partners need? First, they're looking for seamless interoperability with clinical systems. Whether it's integrating a digital tool into an EHR, syncing wearable device data with patient portals, or standardizing how data is exchanged between platforms, tech players need partnerships that allow their solutions to work within the realities of clinical practice. That means medical affairs professionals need to understand workflows, system constraints, and how evidence generation can support adoption. Second, they seek collaboration on AI, real-world evidence, and telemedicine initiatives. Many of these organizations are developing predictive models or data platforms that rely on accurate, timely, and ethically sourced clinical data. Medical affairs can provide critical input, whether it's helping define meaningful endpoints, ensuring the clinical validity of algorithms, or guiding how digital solutions can be used in specific disease areas. Third, they expect support in validating digital biomarkers and technology-based interventions. Whether it's an AI-driven diagnostic tool, a remote monitoring app, or a new method of patient engagement, regulators, payers, and HCPs are all demanding evidence. Medical affairs can lead in co-creating validation studies, collecting outcomes, and helping define what success looks like for these tools, not just in theory, but in daily clinical practice. And finally, technology partners are increasingly looking for long-term strategic collaboration, not just vendor contracts. They want pharma partners who understand digital transformation, who speak the language of user experience, cybersecurity, patient engagement, and data privacy. Medical affairs can serve as a scientific and ethical bridge, ensuring that digital health innovations are safe, effective, clinically meaningful, and aligned with health system goals. So, what does this mean for you? It means that to be truly strategic, medical affairs professionals need to think beyond molecules. You need to understand how data flows, how digital tools are adopted, and how technology is influencing medical decision-making. The future of healthcare will be shaped by how well we partner with these tech innovators. And if we want to lead, not just follow, we need to start treating them as core collaborators in everything we do. Let's now talk about a group that often gets overlooked in strategy meetings, but whose influence can be incredibly powerful: advocacy groups and patient organizations. These aren't just nonprofits doing awareness campaigns. They're organized, informed, and increasingly professionalized partners in research, access, policy, and public engagement. And their voice, it carries weight with regulators, payers, the public, and even industry leadership. So, what do they need? First, they need to be included in development and access strategies from the beginning, not at the end. These organizations want a seat at the table when trial protocols are being developed, when outcomes are being defined, and when decisions about patient support services are being made. They're not just recipients of information, they want to shape it. And when we include them early, we create more relevant, more credible, and more impactful medical strategies. Second, they expect transparency in scientific communication. Many patient organizations now employ medical advisors or have partnerships with clinicians. They read the data, they challenge assumptions, and they expect pharma, especially medical affairs, to be open about both strengths and limitations. We need to speak with clarity, avoid promotional bias, and respect the intelligence and mission of these groups. Third, advocacy organizations are looking for partnership in awareness and education campaigns. Whether it's World Cancer Day or Rare Disease Week, they're driving the conversation, and they often have the public trust that industry lacks. When we collaborate to bring high-quality, evidence-based education into these moments, we don't just amplify our message, we help patients and caregivers make more informed decisions. And finally, they expect recognition as legitimate stakeholders. That means not just engaging them when it's convenient, but building long-term, trust-based relationships. It also means respecting their mission. They are not tools to be used. They are voices to be heard. Medical affairs professionals must be sensitive to boundaries, compliance, and ethics when working with advocacy groups. But that doesn't mean we should avoid engagement. It means we need to do it the right way. So here's the takeaway. Patient organizations are no longer on the sidelines. They're at the center of shaping expectations, defining value, and influencing policy. If you want your medical strategy to resonate at the system level, you need them. Engage early, engage ethically, engage with purpose. Because when advocacy groups trust you, they'll support you. And that support, it's priceless. We've now explored the different players in the healthcare ecosystem, but let's pause and connect the dots. Because here's where things get real. Understanding each stakeholder individually is only the beginning. The real strategic challenge and opportunity lies in aligning them. And let's be honest, this isn't easy. Think about it. Patients want access and affordability. Payers want economic value. HCPs want scientific credibility and clinical relevance. Regulators demand safety and compliance. Tech partners need integration. Advocacy groups expect transparency. Each player has different priorities, timelines, and definitions of success. So what's our role in medical affairs? Our role is to be the strategic connector, to ensure that our data, messaging, and initiatives aren't just tailored, but aligned. That means thinking in systems, not silos. It means asking, how will this scientific insight resonate with multiple stakeholders at once? How do we design evidence plans that meet the expectations of payers, regulators, and patients without compromising scientific integrity? Let's take a quick example. Say you're working on a new therapy for heart failure. You might generate data that shows reduced hospitalizations. That's great for payers. You might also include quality of life metrics that resonates with patients and advocacy groups. Add in a real-world evidence component, and now you've got something regulators, institutions, and even digital health partners can work with. That's strategic alignment. And it doesn't happen by accident, it happens by design. It also means creating cross-functional collaboration internally. If your commercial, market access, RWE, and medical teams aren't working from a shared understanding of stakeholder needs, your messages will conflict. your impact will dilute and trust will erode. Stakeholders notice when we're misaligned, and they reward teams that show clarity and coherence. So here's your call to action. Don't just learn about stakeholders, map them, link them, anticipate how their expectations overlap or collide. Then build your strategy around those pressure points. Because when you get cross-stakeholder alignment, right? That's when your medical strategy stops being reactive and starts becoming truly transformative. And that brings us to the end of this two-part deep dive into the healthcare ecosystem. By now, you've walked through the full landscape: patients, HCPs, payers, regulators, tech innovators, advocacy groups, and institutions. You've seen how each stakeholder plays a unique role, how their needs are evolving, and how they increasingly expect more from medical affairs: more value, more insight, and more collaboration. But here's the real takeaway. This knowledge isn't just for awareness, it's a strategic tool. When you understand the ecosystem, you don't just react to stakeholder demands, you anticipate them. You design smarter evidence plans, build stronger partnerships, and communicate in a way that resonates beyond just one group. You become a connector across science, systems, and society. And that's what strategic medical affairs is all about. So as you move forward in your role or grow into a leadership position, keep this ecosystem mindset with you. Keep mapping stakeholders. Keep asking, what do they need? What do they expect? And how can we meet them where they are while staying true to science and patient value? In our next session, we'll continue building on this strategic foundation with practical tools, frameworks, and real-world examples to help you lead with greater clarity and impact. Until then, thank you for your time, your curiosity, and your commitment to becoming a more strategic medical affairs professional. Let's keep growing.